Hi guys, I'm Dr. Donald Pelto. I'm a full-time podiatrist in Worcester, Massachusetts. Welcome to Podiatry Practice Mastery, where I help other podiatrists develop successful principles and skills in their private practice. I hope you find these videos simple and insightful, and I'd love to hear back from you. Okay, so please comment underneath these videos. Please subscribe to the page. Hi, Don here. Welcome to Podiatry Practice Mastery. I'm going to do this weekly update about one of the patients in my office. Not saying that I have any better way of treating than anyone else, but I just want to kind of share what's working with me here in the office. We're going to talk today about Functional Hallux Limitus. Okay, so here is the patient, her X-ray. This was a younger, like about a 40-year-old female. Got X-rays of both feet. The right foot, she has a little bunion with an IM. If I kind of go over here, you can see a little bit of first ray elevatus right here. So this is where I spend my time talking most of the time to these patients, is I say that this is the elevatus, where I see this part kind of going up and it's jamming. That's where I call it a functional hallux limitus. And then if you look at the other foot, a little bit of a bunion, elevatus as well. And so based on these x-rays, I'm going to have a conversation with the patient about hallux limitus. So I'm going to use my patient presentations. So let me kind of go through that process with you now. The best way to explain these is with something I call a patient presentation. So if you look on the top of my screen here, there is this link that says patient presentations right up there. So let me just use this so I can show this for you. Okay, so it's right up here. And then I'll click the patient presentations. And then it pulls up this patient presentation too. So my recommendation is always, if you could just install this either on your Google Chrome, or even easier, if you want to put it on your website, and you just put a link to this. And I give this out so everyone can use. If you don't have it, you go to patientpresentations.com. And for this patient, what I do in the treatment room is just kind of go down here and I click the hallux limitus presentation. And what I do with the patient is initially I see them in the office, I talk to them, I review their x-rays, and then I'm going to go through this hallux limitus rigidus presentation. So they were having a little bit of pain to the front of the foot. I always ask them the same questions: how long they've had the symptoms, what treatments they've tried, how it impacts their life, and why they want treatment now. Because if they really don't want treatment, there's nothing I can do for this condition. And then I explain to them the difference between mild, moderate, and severe hallux limitus. And then I explain a little bit about the difference between hallux rigidus and hallux limitus. And theirs is based on the functioning of how it functions. I talk a little bit about the cause, and then I talk about some things that can make it worse. And this is my slide to explain about the difference between an X-ray and an ultrasound. So sometimes with the ultrasound, there can be swelling inside of that joint if it's painful. And I talk about this. This is the saying of the same thing that I show them on the X-ray, but showing the importance of first ray elevatus and how this can affect the toe movement. And this is my treatment evaluator slide. When I show this to patients, you can see this little light, but I'm going to show you how you do it on here. If you click this and you put turn on laser pointer, it actually turns on a laser. There's two of them now because I have two, but that's how you turn it on. So as I'm showing patients this, I'm going to explain, and I pull up my computer in each treatment room. I say that some things are most effective, others that are least effective, and we're going to focus on three things: reducing the pain if they have pain, reducing the joint jamming even if they don't have pain, and then some of the advanced treatments. And I normally start, if they're having pain, I'll start with an anti-inflammatories, icing, and contrast baths. And then if it's a lot of pain, I might do a cortisone injection. I don't do a lot of shockwave for patients. I don't find it works great with arthritis, but it can help with some of the swelling around the structures in the joint. So certain patients that might have a little bit of pain, they don't want a cortisone injection. It might be a benefit to do shockwave for them. My main focus is going to be on orthotics for the patients. They could also try a rigid shoe or a carbon insert. If you notice in this presentation, if you want to use it, there is a link that you click. This says custom orthotics. And if you click this, it'll go to that slide. So it'll talk a little bit about custom orthotics. and the importance of a Morton's extension in there, or a Cluffy wedge, depending. As you know, if there's a bad joint, I try to reduce it with a first ray, right, extension there. If it's a good joint, I'll try to increase the movement with a Cluffy wedge and a first ray cutout. And so to go back with the slides, you don't want to go backwards with your mouse. What you want to do is you want to go backwards up here. And that's how you can go back to the actual slide deck we were at. And then I also talk about surgical intervention. So what I usually start them out is with a level 4 new patient visit, because I'm prescribing them some type of an anti-inflammatory, icing and contrast baths. And then this patient, she got an orthotic, and then I'm going to see her back after she picks them up. And then I'm also going to send her some information on Patient Education Genius. The way I do it in the EMR is a little bit different, but I'm going to show you by logging into their site, because it can connect with the medical record. And when it connects with the medical record, it actually pulls in their email and their information automatically. That's the benefit of using it or integrating it. But at this point, I really couldn't live without this Patient Education Genius. So what I send these patients, actually, I don't send it now, my scribe does, but I can explain that more if you want. They always send this something called a new patient welcome packet. Okay. And what this is something we call a shock and awe package. If you're not familiar with it, it's a really big, it's like a welcome video with a PDF that they can learn more about the practice. So I always send that. And then based on the diagnosis, my scribe can go down here and pick out what information. So this specific patient has hallux limitus and rigidus. And there's a couple of things that can be chosen. And based on what I say to the patient, they pick the stuff. Most of my patients now, I use this thing called the treatment process. So all of them are labeled the same, hallux limitus treatment process. Let's say though I want to share the webinar that we did. We did a webinar on it. I can share that. But most of my patients get this one here. So they're going to get that welcome packet, and they're going to get this hallux limitus. And then if I want to give them something on, like to give a review or something else, I can. Let me just show you what they're going to get. I put together a blog on most things that I treat in the office. And this blog is the following. It is a video, a short video, a 6-minute video with my whole treatment process and different other products, and then some products on Amazon. Okay. And then, so I try not to give them. The mistake I made in the past when I did this is I gave patients too much information and they didn't look at any of it. So I try to send them 1 or 2 links at most. And then when I send it, I can either put their email or cell phone, or if I'm using my medical record, it sends it over to them that way. Okay, that's how that works with Patient Education Genius. And then also when they get that link in either via text message, they click it and it has other options. And the most important option is it has an option to give an online review. So those are just some ideas about how to treat hallux limitus, hallux rigidus. Hopefully that was beneficial for you. Okay, thanks.